Hi guys, welcome back to the channel. In this video I will be covering the cardiac cycle from the mass transport in animals topic from the A-level biology curriculum. We have been covering mass transport in animals already, so if you would like to watch the previous videos you can click the link popping up now. Okay, so looking at the heart structure first. So you need to know about the coronary arteries. So these are the arteries which are located on the outside of the heart. So we're not talking about the inside, we're talking about the outside of the heart. And these coronary arteries are very important as they supply our hearts and the heart muscles with oxygen as well as glucose. Because if you remember, heart's a muscle and it needs oxygen and glucose to be able to respire. Just carrying on from the heart structure, one thing you need to realize before anything is that whenever you look at a diagram provided in an exam question, that the right side of the heart will be on the left of the diagram and the left side would be on the right. So this is basically, if you imagine, if you're looking at a person who is directly in front of you and you're looking at their heart, then the right side of the heart would be on your left and the left side of the heart would be on your right. So just remember this. Okay, so now if we talk about how blood would enter the heart, so if we're talking about the right side of the heart, so this would be the left in the diagram. So we talk about vena cava. So we have two types of vena cava. One is inferior vena cava, so this will be located near the bottom, and one would be a superior vena cava, which would be located near the top. So you just need to remember that vena cava brings deoxygenated blood into the heart through the right atrium. So the deoxygenated blood which is returning from being used in the body, which will be low in oxygen, enters the heart through the vena cava and it will enter the right atrium, so this place here. And then what would happen then is through the atrioventricular valve, the blood would be passed down to the right ventricle, and from the right ventricle and through the semilunar valve it would be transported to the pulmonary artery to be transported to the lungs and to be oxygenated again. So this is the right side of the heart. So now if we were looking at the left side of the heart, so we'd be talking about the pulmonary vein. So this is carrying the blood back from the lungs into the heart. So this is now through the vein. So it's carrying blood in to the heart, so vein. So this blood will be now oxygenated as it's come from the lung. So then what would happen, the blood would pass to the left atrium, so this place here, and then it would pass to the left ventricle, again through the atrioventricular valve, and then it would pass to the aorta, which would be through the semilunar valve, and then it would, this oxygenated blood could be transported to the body and the organs. And one thing they could sometimes bring up is the septum, so this middle bit here. So what you need to remember is this middle bit is basically a barrier which prevents mixing of deoxygenated and oxygenated blood. So if the deoxygenated and oxygenated blood mixed, and that would mean that the person may not get enough oxygenated blood and their cells might not be able to respire, which could be fatal. Right, so now we will be looking into valves. So you need to be aware of two types of valves. First is the atrioventricular valve between the atria and ventricle. The name just gives this away. So these are located between the right atrium and the right ventricle, as well as the left atrium and left ventricle. And also the semilunar valve, and these are located between the ventricle and artery. So between the right ventricle and the pulmonary artery, as well as the left ventricle and the aorta. All right, so how do valves work? So valves only open when the pressure is greater behind the valve. So for example, if the blood was meant to go up straight, the valve would only open if the pressure was greater behind the valve, to allow the blood to flow straight up. But if the pressure was greater above the valve, so this could cause the blood to flow downwards opposed to upwards, then the valve would remain closed, you can see. So why is this important? Now this means that this prevents the backflow of blood, and this would maintain a unidirectional flow of blood. So unidirectional just meaning that this would be in one direction, and this in turn just maintains the pressure of the blood, which is very important. Now looking into ventricles. So ventricles have a thicker wall comparing to the atria. As you can see here, for example, these ventricles here have a thicker wall than the atria above them. So what does that mean? So because the ventricles have a thicker wall, this just means that when they contract, the contractions are stronger. So this would mean that the pressure would be greater when they contract. Now, if we were to look at the left ventricle specifically, so looking at this has the thickest wall compared to all the other chambers, including the right ventricle. Now, this is because this leads to a very high pressure, and this is because the aorta, so the left ventricle would be transporting the blood to the aorta, and because the aorta has to transport the blood to the whole body, at this high pressure ensures that the blood is transported to the whole body. If this were just a low pressure, this would be very difficult. And this is why atrias have a lower pressure than ventricle, because atrias would just be transporting the blood to the ventricles, whereas the ventricles have to transport the blood further away than the atria. Right, so now we'll be looking at how the blood moves in the heart. So you need to know that the blood moves down the pressure gradient, so from a high pressure to a low pressure. And there are basically 3 steps we can split the movement of heart into. So first, the diastole. Diastole just meaning relaxing, so this is where both the atria and the ventricles are relaxing. Next is the atrial systole, where the atria are contracting, and next finally is the ventricle systole, where the ventricles are contracting. So first looking at diastole in more detail. So you need to know that in diastole both the atria and the ventricles are relaxing. So this in turn just increases the volume and decreases the pressure inside the chambers. So looking at a diagram, so as you can see, comparing relaxed heart to the contracted heart, you can see that the relaxed heart has a bigger volume compared to the contracted heart. So bigger volume just means there is a lower pressure inside the chambers. So what would happen is, because there is a lower pressure inside, the blood from the veins, such as the pulmonary vein and the vena cava, would start to fill the atria. So this would be again down the pressure gradient. So now looking at the diagram, so through the pulmonary vein and through the pulmonary artery, the right atrium and the left atrium has started to fill in with blood, which is increasing its pressure. So now looking at the atrial systole, so when the atria would be contracting. So yeah, the first step would be the atria contract and the ventricles would remain relaxed. And this decreases the volume because the atria contracting, the space gets smaller. And this in turn would increase the pressure inside the atrium. So this left atrium is contracted and this right atrium has contracted. Now what does this do? So this causes the atrioventricular valves to open. So remember, the atrioventricular valves are between the atria and the ventricles, and these open because the pressure inside the atria is now greater than the pressure inside the ventricles. Now, because we had that blood moving in, and now because the volume has been decreased by the contraction, this has caused the pressure to be greater in the atria, and then the ventricles are still relaxed. So now because the pressure is greater in the atria than the ventricles, it causes the atrioventricular valves to be open. and this just means that the blood will be pushed into the ventricle. So because now this is open, the blood will now start to go into the left and the right ventricle. Now looking at the final step, now this is the ventricle systole. So in this, the ventricles contract and the atria are relaxed. So the ventricles contracting would again decrease the volume and increase the pressure inside the ventricle. So the ventricles would become even smaller, and this just increases the pressure. And this causes the semilunar valves to open. So remember, semilunar valves are between the ventricle and the arteries. So now these are open because the pressure inside the ventricles is greater than the pressure inside the arteries. So the blood moving in and the walls of the ventricle contracting has caused the pressure inside the ventricles to be very high, and this is now higher than the pressure inside the arteries, for example the aorta or the pulmonary artery, and this has caused the semilunar valve to open. So the atrioventricular valves would close now because the pressure inside ventricles is greater than the pressure inside arteries. Remember that we want to prevent any backflow of blood happening. So now because the ventricles have a greater pressure than the atria, so we just want this atrioventricular valve to close now, so the blood would remain in the ventricles or pass on to the arteries instead of going back into the atria. And because of this, the blood would be pushed out of the ventricles through the artery. So the arteries, we're talking about the pulmonary artery and the aorta, to be passed on to the lungs as well as the body for the aorta. So you need to be aware of the cardiac outputs. So to be aware of this, there's a few definitions that you need to be aware of first. So first, looking at the definition of the cardiac output itself. So this is basically the volume of blood which is pumped out of the heart per minute. So we usually measure that in centimeters cubed. Basically the blood which will be flushed out of the heart, and this is every minute. And next is the stroke volume. So this is the volume of blood instead of being in a minute now, it is in one heartbeat. So in one heartbeat, how much volume of blood is pumped out of the heart. And finally, the heart rate is basically the number of cardiac cycles that occur per minute. So a cardiac cycle would include all the three steps, so the diastole, and the atrial systole and the ventricle systole. So that would together make up a cardiac cycle, and the heart rate is basically the number of cardiac cycles that can occur per minute. So looking at the formula for calculating the cardiac outputs, it basically is the stroke volume times the heart rate. So you can, if you prefer using the triangle, so cardiac output would be at the top, and the stroke volume and the heart rate are combining, it would be timesing together to get the cardiac output. Okay, so the cardiac output questions have been common type of questions in the past examinations, so I'll just go through an example. So for example, if you've been given this graph and asked to calculate the cardiac output, so you need to remember the equation. So cardiac output would be equal to stroke volume times heart rate. So I'll just first look at the heart rate now. So to find heart rate, you basically need to find 2 points on the graph which lie in the same exact position. So from this graph, what I can see is them 2 points are in the same position. So this would just be one cardiac cycle. So to calculate the heart rate, what I would need to do is find the time taken for one cardiac cycle to be completed. So looking at this, what I can see is that the cardiac cycle starts at 0.1, ends at 0.9, so the cardiac cycle takes 0.8 seconds to be completed. So if one cardiac cycle takes 0.8 seconds to be completed, so how many cardiac cycles can I fit in 1 minute? So what I would just do is, because this is in seconds, what I can just simply do is 60 divided by 0.8 to find how many cardiac cycles would occur in 1 minute, and this would be 75. So 75 would be my heart rate. Okay, even though I've got the heart rate, I still need to get the stroke volume. So to get the stroke volume, what I do is I would look at the highest point on my graph as well as the lowest point on the graph, because this will be the blood that will be displaced away from the heart in one heartbeat. So looking at this, I get that the starting volume is 60 centimeter cubed, and at the end we end up having 130 centimeter cubed. So taking that away, I get 70 as my 70 centimeters cubed as my stroke volume. So now what I simply do is I would just times 75 and 70 together to get my stroke volume of 5,250 centimeter cubed. Okay, so risk factors of cardiovascular diseases. Now, I'm not able to cover all the risk factors and how they impact the cardiovascular diseases, but I'll just be looking at the main ones. So smoking, unhealthy diet, insufficient exercise, as well as genetic factors can lead to build-up of fatty deposits in the arteries. I'll be mainly focusing on the coronary arteries, and the fatty deposits are called atheroma. Now, you don't need to make notes on this, and this is just for you to understand. So as you can see in this, there are fatty deposits being placed inside the arteries, and these are atheroma. And these fatty deposits can cause the narrowing of coronary arteries. So remember, coronary arteries are responsible for supplying glucose as well as oxygen to the heart muscle. So because of these atheromas, these fatty deposits, it restricts the blood flow to the heart muscle, which supplies the glucose and which supplies glucose and oxygen. So looking at a diagram again, as you can see, so inside this, outside the heart, we have these fatty deposits forming, which is restricting the blood flow. And this just means that a heart cannot carry enough aerobic respiration to produce its ATP and carry out its metabolic processes, and this can damage heart tissue. Now, if you remember, if you can't carry out aerobic respiration, the only alternative will be anaerobic respiration, and this would just mean that the heart muscle would be producing lactate, which is toxic, and if it keeps doing that, then this would just mean that the heart muscle would start to die out. So this is damaging the heart tissue, and this is caused by the risk factors such as smoking, unhealthy diet, not enough exercise.